Hello everyone, I'm Dr Yamini Agarwal, consultant in Reproductive Medicine in Genome Fertility Centre, Siliguri. Today I am going to discuss a very important topic, that is male infertility. So because we know that in our society, it is a myth that if a couple is having problem in conceiving, it is only the female who has to be blamed. But let me tell you, it is not so. 4 out of 10 couples, the reason is that the male is infertile other than the female. So we see that in subfertile couples, 1/3 of the cases, the reason is the female. In 1/3 of the cases, the reason is male, and the other 1/3, it can be both. So what are the things, how do we know that a male is fertile or not? By simply looking at the male, it is very difficult to know whether the male is fertile or not. So the first and foremost thing which we have to do is the semen analysis. The test is very simple but very important as well. This test is very simple as the husband has to give his semen, and the semen has to be examined under the microscope in the lab. There are certain things which we see in semen, that is the count, the sperm count, the swimming number of sperms, that is the motility of the sperm, and how the sperm look like, that is the morphology of the sperms. So what are the causes? Why do males suffer from infertility? So there are various reasons nowadays. Maybe some lifestyle changes like obesity or smoking, alcohol, excessive laptop use, putting on the laps, mobiles, excessive use of mobiles, radiations, and excessive heat exposure may be also one of the reasons. Maybe some kind of occupation which might need heat exposure to the area. Or there might be some reasons like any surgical procedures which have been done in the past, like operated for hernia or hydrocele, or might be some kind of infections which has happened in the past. So the most important test for a male to know whether the male is fertile or not, the simple and the single most important test is husband semen analysis. So how do we treat male infertility? Sometimes if the sperm count is in a borderline number, like if the count is less or the motility is less, we can give some kind of treatment like antioxidants and advise the patient to have nutritious diet and improve his lifestyle, stop smoking alcohol, maintain a healthy weight, and avoid excessive heat exposure to the area. So that thing might do. But in certain cases, when the sperm count is very low or the motility is very low, sometimes we find that the sperm quality is not good, or the sperms are dead, or there are no sperms in the semen. In these cases, we have to undergo some kind of procedure. They have to undergo some kind of procedure like intrauterine insemination or test tube baby. So in IVF also we have different kinds of things. One is ICSI, in which the ICSI, that is intracytoplasmic sperm injection, it is done when sperm count is very low and IVF or normal intrauterine insemination is not possible. Or sometimes when the sperm count is nil, that is there are no sperms in the semen, we can go for TESA, that is testicular sperm aspiration, when there is some hope that by taking a biopsy from the testis or taking some aspirate from the testis, we might get a few number of sperms which we can unite with the eggs. So last but not the least, if nothing is possible, the donor sperm is always there. Thank you for watching the video.